Liam Gallagher, Oasis frontman, has said that he would rather be in pain than face what he sees as the stigma of getting a hip replacement. Which intrigued us. Is there still a stigma around hip replacements? Joining me now is running coach Elke Mays, who has had a hip replacement at the age of 39. Good morning, Elke.
Good morning.
Good morning. And GP and author Talha Sami. Hi, Talha.
Hi, hello.
Hi, morning to you. So, Elke, 39 is pretty young. I take it that was because of your athletic career, yeah?
Yes, I had a traumatic injury coming off the bike, and initially they tried to pin the hip back together, but it didn't work. And 5 months on, after being in a wheelchair and on crutches for most of that time, I then elected for a hip replacement. I'm glad that I had the operation.
Yeah, I mean, as you say, nobody wants surgery, but is there something particular, do you think, about the hip operation? He seemed to be reacting specifically to the hip operation.
Yeah, it's strange because the hip operation is so successful. If you look at it in comparison with a knee operation, a knee replacement, the hip is an incredible operation. It is a very invasive procedure, and as he said, you do have to break the hip to put a new one in. It's strange he feels there's that stigma.
I mean, Talha, when you get, I guess, particularly younger people who may need a hip replacement for whatever reason, do they have a reticence? Do you see that?
Actually, no, I don't. And I totally agree with your other guest there. And I think the issue here really comes to the quality of life, because people come to us when their quality of life is so severely affected, they can't do the things that they love. Now, of course, the majority of our work when it comes to hips and knees is to do with the older population. And when you think about giving a grandmother an extra 10, 15 years of mobility to walk in the park, to do the things that she enjoys, spend time with her grandchildren, I think those things really speak for themselves. Or even your other wonderful guest who's now, got her, career back, as it were.
But I mean, I guess as you say, I mean, the example you gave is, when you think of a grandmother, and I don't know, maybe that's where Liam Gallagher is coming from, because it has been such a successful operation and is associated with a particular age group. Maybe potentially that's where the stigma might lie, because he might think, I'm a rock star, I'm not a granddad.
He's also human too. So I think we all need help when we need it, right? And if I can just pick up on some of the comments that he made. Look, every patient has their own autonomy to do whatever they will, and that's a decision that he respectfully has made. But I think there are some deeper elements there in some of the comments that he made. He says he can't sleep. He's using painkillers. He's using herbal remedies for tablets. Now, how long will something like that last? Certainly, I imagine most people don't want to live like that, and he even said he doesn't enjoy living that way. So perhaps for him, he felt that's the right decision, and he's clearly a robust individual that he's made that decision. But what if you're a lorry driver, or you're a builder, or you work in a desk job, and you need your mobility to get to work, and maybe that decision can't be made the same way for everyone.
I mean, Elke's hip replacement came as the result of trauma. With Liam Gallagher, it's arthritis, and I believe that's the most common cause, Talha, is that right?
Absolutely correct.
So what is happening that requires the hip to be replaced?
I always say to my patients, look, we're not here to live forever, and our bodies are naturally meant to deteriorate. So, not everyone's 25 forever. So what happens with an osteoarthritis, which you mentioned being the primary cause, is wear and tear of the joint. No different to, say, for example, wear and tear of your car. Now, when it comes to interventions, we always stage medical interventions within about 3 stages. One of them is we watch and we wait, so we do nothing. Perhaps you could take some painkillers here and there. The next one would maybe be something where we intervene. We could, for example, refer to physio. We can strengthen muscles around the hip and around the back. And it's important to note that hip pain can often be associated with back pain, and back pain can actually be associated with hip pain. So these two tie in together. When these methods, painkillers, physio, have not done the job, then we do refer to the orthopedic doctors who do their assessments, and they don't always necessarily immediately jump to surgery. They may consider an arthroscopy where they clean out the joint, and that's just a day procedure. And if still needed, then of course they can go to a hip replacement. There are different types, and the success rate is about 90% or upwards. And it's a joy to see people, they've got their quality of life back after having such a procedure. And these things can last 10 to 15 years.
I mean, LK, are you confident that you'll get back to full pace? I'm actually thinking of Andy Murray. I mean, goodness, what a great role model he is for people in sport, having had a hip replacement.
Yeah, absolutely. He's doing so well. I think for me, I lay in A&E wondering whether I'd walk again when I initially had the accident, and I'm so pleased to have got back to where I am. Realistically, I don't think I'm going to be running marathons, in less than 3 hours again. However, I can run to a point, and I take a lot of enjoyment from that. That my level was very high, so I'm sort of, from a general quality of life point of view, I'm in a really good position.
Yeah, and pain-free.
Pain-free, absolutely.
Yeah, which is a huge factor, isn't it? That will apply to lots of people who want to live in pain. Elke, thank you very much, Elke Mays. Thanks also to Talha Sami there, who's a GP. Lots of you saying you had successful hip operations. Alison Argyle, hip replacement in 2013 when I was 50. My sister had a knee replaced at 56. Quality of life so much better. Pain-free and mobile. He's being daft. Ian Verreer says, got my hip done after 15 years of chronic pain, age 47. I have not looked back in anger. He apologises for that one, but Ian, no, you're forgiven. And Isabel, the same, had a hip replacement 9 years ago, and it was life-changing.
On digital radio, FM, your smart speaker, and BBC Sounds.